My name is Kendra Weindling, and I'm the Stakeholder Engagement Manager with the Virginia Health Benefit Exchange. And I am presenting this information for small business owners so that you all are aware of some options that you may have when looking at different ways to provide coverage for your employees. So on our agenda today, we're going to talk about the background of marketplace insurance, the creation of the Health Benefit Exchange and the transition to a state-based marketplace, the benefits of the marketplace, some options for small businesses, which include Health Options Program or SHOP, some options under health reimbursement arrangements, and we're just going to provide some overall information on the marketplace. We'll review the health plan options, when to enroll, and how consumers can enroll. So for a little bit of background on the marketplace, in 2010, the Affordable Care Act, or ACA, was passed. And in 2013, the federally facilitated marketplace, HealthCare.gov, was created. And that gave individuals a way to shop online and compare different plan options and apply for financial assistance through the tax credits and cost sharing reductions. At that time, states had the option of setting up their own state-based marketplace, or they could opt to use HealthCare.gov. At the time, Virginia opted to use HealthCare.gov, but in 2020, the General Assembly directed the State Corporation Commission to establish the Health Benefit Exchange. And with that, we began the process of transitioning away from healthcare.gov and setting up our own state-based marketplace. We did begin our first open enrollment on our state-based marketplace for 2024 plans. So it began November 1st of 2023 to start shopping for 2024 plans. And we have been operating as a state-based marketplace since then. So when the State Corporation Commission was directed to establish the Health Benefit Exchange, they were given 3 statutory duties. One was to transition Virginia away from healthcare.gov and to a Virginia-based marketplace, which we have done now. One was to better coordinate with Virginia agencies to support health insurance continuity. So in order to do that, we work with a lot of the different state agencies and other groups that might encounter people who are underserved to ensure that they have the information that they need to make sure everybody knows about the marketplace and can enroll. And then our third statutory duty was to work to reduce the number of uninsured Virginians. And that's one of the reasons we wanted to present this information, because we know that coverage for employees in small businesses can be a challenge. So what is Virginia's insurance marketplace? We fully replaced healthcare.gov for Virginia. Again, like I said earlier, starting on November 1st of 2023 for all 2024 plans. The shopping through Virginia's insurance marketplace provides health plan shopping and enrollment services for individuals, families, and small businesses. In order to be eligible, individuals or households must reside in Virginia, be U.S. citizens, U.S. nationals, or lawfully present immigrants for the entire time they plan to have coverage. They cannot be incarcerated unless they're pending disposition of charges. And they need to be generally uninsured, not eligible for Medicaid or Medicare, and not have an offer of affordable employer-based coverage. And one of the things that I want to stress here is affordable. So that is set each year. The level, the qualifier for affordable is set by CMS. And so for 2025 plans, it was 9.02% of the salary. So if the premium costs more than that, it's not considered affordable, and they can come to the marketplace and shop and be eligible for financial assistance. If the premium is less than or equal to that, it is considered affordable coverage, and they are not eligible for financial assistance through the marketplace. So some of the benefits of shopping at Virginia's insurance marketplace include that all of our plans are approved by the Bureau of Insurance and certified by the exchange as meeting the Affordable Care Act coverage requirements and consumer protections. We have no fraudulent plans or websites. One thing I do want to stress is people do need to be careful to make sure that they're on the correct website, which is marketplace.virginia.gov, because there are a lot of sites that may try to mimic our site, so that people go there and then they will not be able to shop for qualified health plans with financial assistance. It's important that they're on the .gov site. This is the only place that individuals can access the financial assistance like tax credits and cost sharing reductions. We do have free local assistance available to help anybody with applications or enrollment questions. We have both insurance agents that are certified and navigators, and they can connect with assistance through our website. Small businesses can enroll any time of year in SHOP plans, which we're going to cover a little bit later. Virginians can compare health plans and use the Get an Estimate tool to compare and browse through the plans and see how much they can save. And then also our platform and our Consumer Assistance Center are tailored to reflect the needs of Virginians, and they are integrated. So this allows us to be more responsive to the unique needs of Virginians. So what is covered? All of our plans that are qualified health plans have to cover the 10 essential health benefits. So they're listed here on this screen. And, some highlights, I'm not going to read them all, but prescription drugs are covered, rehab services are covered, mental health and substance use disorder services, including behavioral health treatment such as counseling and psychotherapy, must be covered. All of our plans are required to cover preventative and wellness services and chronic disease management. And that's just to name some of the essential health benefits. So our plans on our marketplace do fall into different categories. The first category is catastrophic coverage, and it's important to note that catastrophic coverage is not considered a qualified health plan. So if somebody is wanting to get financial assistance or use some of the options available to small businesses, they cannot purchase a qualified health plan or a catastrophic plan. They need to purchase bronze, silver, gold, or platinum. And basically, those are broken down into different categories, with bronze generally having the lowest premiums, but will have higher out-of-pocket expenses. So bronze plans will generally cover about 60% of the actuarial value, and consumers will pay about 40%. And then moving up to silver, they'll have a slightly lower premium, they'll have a slightly higher premium and slightly lower out-of-pocket cost, all the way up to platinum, which is going to have the highest premiums, but the lowest out-of-pocket costs. And it's important that consumers, when they're enrolling, they understand these different options, because somebody who goes to the doctor 1 or 2 times a year may be better off in a bronze plan where they're going to pay lower premiums. Somebody who's got a chronic illness and sees the doctor on a very regular basis throughout the year may be better off in a gold or platinum plan, where they're going to have higher premiums but lower out-of-pocket costs. And that can really vary person to person. So it's important that they just understand what the options are. So for small businesses, we do have 3 options. And as we know, health insurance is extremely important to employees, and it can be a powerful tool for small businesses when they're recruiting new employees and wanting to retain their best workers, because sometimes employees have to leave to go work for a larger employer if they don't have health insurance. So our first option for small businesses is the Small Business Health Option Program, or SHOP. And using this option, so small businesses are not required to purchase health insurance for their employees, but if they do purchase through SHOP, they may qualify for a tax credit. Another option for small businesses is health reimbursement accounts, or HRAs. And then the third option is to just provide education for employees on the marketplace, so that employees can come to the marketplace and enroll in individual insurance through our platform and possibly qualify for some financial assistance, even if the employer isn't able to provide any. So this is the landing page in our website for the SHOP program. Just kind of wanted you all to see what that looks like. And then some of the advantages of SHOP, like we already talked about, retaining good employees who see the value of employer-provided insurance in their compensation statements. That's a huge advantage to the SHOP program. It helps small businesses and nonprofit organizations provide health insurance coverage to their employees. It's the only place where small businesses may qualify for the federal tax credits through the IRS when they submit taxes. And employers can apply the tax credits to lower the cost of employee premiums. And employees pay for health insurance premiums pre-tax, which lowers their tax bill. Some additional advantages is that SHOP allows for flexibility for health insurance plans for employees, as it is the single most expensive benefit offered by employers. Businesses can sign up at any time of the year. So we typically have an open enrollment period, but businesses who are signing up for SHOP can do so at any time. And we do have, through our website, you can access insurance agents that are authorized to assist all businesses with direct enrollment, and help with the SHOP plans. And in order to do so, they must be certified by the exchange so that we can ensure that they are knowledgeable. So here are the 2 enrollment options that you have through SHOP. One is the employer choice. So with the employer choice, the employer selects one insurance company that offers coverage, and then the employees can choose any plan from any metal level that that insurance company offers. So say you choose one particular insurance company and they offer bronze, silver, gold, and platinum. Your employees can each choose a different metal level. The other option is more of the employee choice. And in this option, the employer selects up to 2 consecutive metal levels. And then the employees can choose any plan across all the insurance companies that offer those 2 metal levels. So say you want to offer silver and gold, then your employees can select any insurance company that offers those metal levels. And so they get the choice of insurance companies and you choose the metal level. So the small business healthcare tax credit, small businesses may qualify for this tax credit if they buy group health insurance coverage through SHOP on the marketplace. You need to have fewer than 25 full-time employees. And you can qualify if some are part-time. We have had people ask, what's the minimum number? And the minimum number of full-time employees is 1, but the total full-time employees do not include the owner's spouse, or the family members. So as long as you have at least 1 and no more than 25 full-time employers that are not the owner's spouse, or family members, that is one of the criteria to qualify for the healthcare tax credit. Additionally, pay an average salary of, in 2024, it was $65,000 or less. And it does adjust for inflation each year. And this average salary excludes the wages for owner's spouse, and family members. So you may be paying some of your employees more than $65,000 a year, but if you're paying others less and it averages out to whatever that amount is for the year, then you would be able to qualify for the tax credit. And then also you have to contribute at least 50% towards employee-only health insurance premiums. Amounts paid toward dependent coverage, if you offer that, may also be included in the total. And then we've provided a link there for you to get more information. So again, this is just a page in our platform, and it shows you how you can find a SHOP certified agent. And you can find one within your zip code, so they won't be too far away. They'll be able to come and meet with you and help you figure out what your best options are. Okay, another option for small businesses is the health reimbursement arrangements, or HRAs. And so for small businesses that don't offer traditional group health insurance plan, you can offer a tax-free health reimbursement arrangement. And this is an alternative to traditional group insurance. And to use an HRA, the employee must have an individual health plan obtained through the marketplace, Medicare, or a private insurer. And with an HRA, the employer reimburses their employees tax-free for qualifying healthcare expenses. And those healthcare expenses can include the premiums, deductibles, co-payments. So for the marketplace premium tax credit and the HRA, it's important that the employee knows whether the HRA offer meets the federal affordability standard. And we talked about that earlier. That's that standard that is set by CMS each year. And if it doesn't meet or does meet the affordability standard, it may affect the eligibility for the premium tax credits for coverage that's obtained through the marketplace. And that's set, like I said, I said CMS, I apologize, it's IRS that sets that. And you can do the calculation on the marketplace platform to determine whether or not, based on household income size and the dollar amount of the contribution, whether or not it meets that affordability standard. And for 2025, it is 9.02% of household income. And eligibility for premium tax credits are based on this calculation. So if you're going to offer your employees an HRA, you as the employer are required to tell the employees if you're offering an HRA, and the notice has to tell the employees whether the HRA covers dependents, the total amount that the employer will reimburse, and the start and end date of the coverage. And if a new employee gains access to an HRA outside of the open enrollment. So our open enrollment on the marketplace is November 1st through January 15th. But if they gain access to an HRA outside of that open enrollment period, they will have a 60-day special enrollment period. So they will be able to come to the marketplace and shop for a plan or update their existing coverage. When you give them the offer letter, it has to include the employee's name, the coverage start and end dates, their eligibility, the dollar amount offered in the HRA benefit, and the requirement that the employee enrolls in minimum essential coverage, or MEC. So again, going back to the different types of coverage, they cannot choose a catastrophic plan because that is not minimum essential coverage. So they have to be enrolled in a bronze, silver, gold, or platinum. And the letter has to state that the reimbursements from the HRA are non-taxable due to the employee having minimum essential coverage. So there are two types of HRAs. One is a qualified small employer HRA, or a QSERA, and the other is an individual coverage HRA, or ICHRA. And they have different eligibility standards, contribution limits, and affordability requirements. So for the QSERA, it is for small employers that have fewer than 50 employees and don't offer a group health plan. For the ICHRA, it's for employers of any size. Employers of any size are able to offer an ICHRA. For the employer contribution, under the QSERA benefit, it is an employer-defined contribution and there is an annual maximum. For the ICHRA, it's also an employer-defined contribution, so you as the small business define the contribution for both, but with the ICHRA, there's no annual maximum. And then affordability. So the employee's eligibility for the financial assistance, which would be the premium tax credits and the cost sharing reductions, depends on whether the HRA offer is considered affordable by federal standards. If the offer is unaffordable under a QSERA, they are able to reduce the amount of premium tax credit by the dollar amount offered by the employer. So basically, they can combine their QSERA and their tax credits. With an ICHRA, if they accept an ICHRA, they cannot get premium tax credits. So even if the ICHRA is not considered to be affordable by that IRS determined affordability level, if they accept the ICHRA, they cannot get premium tax credits or cost sharing reductions. So, but they can decline the ICHRA if it's not affordable. And if it's not affordable and they decline the ICHRA, then they are eligible for the premium tax credits. So this chart shows the contribution limits under QSERA. And as you can see, there's an annual maximum amount for self-only coverage and for family coverage. There's an annual amount and a monthly amount. One of the key things to know is that if you have an employee who starts midway through the year, you do need to prorate that. So if they're only employed with you for 4 months out of the year, for under 2025 monthly amount, you're going to take that $529.16 and multiply it by 4. And that's the maximum amount that you can contribute to the QSERA. And again, just a reminder that if the QSERA does not meet the affordability standard, the consumer may qualify for financial assistance through the premium tax credits and cost sharing reductions if all the other eligibility factors are met, and that includes income, household size, tax filing status, etc. So it's important that they understand that, they do that calculation and look at what their options are. Okay, with ICHRAs, or individual coverage health reimbursement arrangements, that is an individual arrangement offered in place of traditional health insurance by employers of any size, and you use that to reimburse your employees for their medical expenses. It does require minimum essential coverage, but the employee may qualify to have coverage through the exchange with financial assistance provided both of the following criteria are met. So if the ICHRA does not meet the affordability standard when compared with the silver benchmark plan, and they do not accept the ICHRA, so they have to actually decline the ICHRA. If the ICHRA meets the affordability standard when compared to that silver benchmark plan and the employee declines the ICHRA, they will not be eligible for the tax credits or cost sharing reductions. So it's very important that they understand that distinction. And here's where, again, working with certified agents or navigators can help you and help your employees understand what the options are and what's affordable and what's not. And this again just shows whether or not an employee can get APTCs or advanced premium tax credits towards their marketplace coverage. Under QSARA, they can, as long as the QSARA doesn't meet the affordability standard and they qualify under all the other eligibility factors. With the ICHRA, they cannot have both. So it's one or the other. And the notice of an offer of HRA must be provided as documentation on the marketplace platform when they come to enroll in a health plan. So they will need to have that letter so that they can provide that as their documentation. When can consumers enroll in coverage? Employers who are interested in shop plans can purchase at any time of the year. So if you're looking at a shop plan for your employees, you can reach out, you can purchase that at any time of the year. Otherwise, consumers can enroll during open enrollment, and that has traditionally been November 1st to January 15th. And then throughout the year, we do also offer special enrollment periods, and those allow consumers to purchase a marketplace plan or make changes to an existing plan outside of open enrollment. But in order to qualify for a special enrollment period, they need to experience a qualifying life event. And one of the things I want to stress here is that providing an HRA to your employees would qualify as a qualifying life event. And there's a link there that you can look at. And there's also a slide coming up that shows you what some of the qualifying life events are. But the key one for you to know is that providing an HRA, newly providing an HRA, or providing an HRA to a newly hired employee is a qualifying life event. And under special enrollment periods, there are specific timeframes that they must adhere to, and most will require documentation of the QLE. So of interest for you all, providing the HRA will give your employees a qualifying life event and open a special enrollment period. It is a 60-day open enrollment or special enrollment period, so they will have 60 days to enroll. If they wait longer than that, they will need to wait for open enrollment. And then they'll need that letter from you showing what the HRA is. And again, if you can't purchase a shop plan or provide an HRA to your employees, we want you to be aware that they may still be able to enroll in a health plan on the marketplace during open enrollment or outside of open enrollment if they have one of our other qualifying life events. And the qualifying life events are kind of fall into different categories. Like I said, one is receiving an HRA from an employer. One is loss of health coverage. So if they were recently employed and they left that job, whether they left voluntarily or they lost their job, if they had coverage through that job, it gives them a special enrollment period. That's a qualifying life event. Also, changes in household can open special enrollment periods, such as marriage, divorce, birth, adoption, legal separation, gaining a court-appointed dependent, or death in the family. Changes in residence may open a special enrollment period. The key here is if they are enrolled in coverage and they move, but their current coverage still provides coverage in the area they moved to. Like say they moved half a mile away to a different apartment. and the plan that they had still provides coverage in that area, that does not give them a special enrollment period. However, if they move outside of the coverage area of their current plan, and obviously for people moving into the state of Virginia, where they would not have coverage from their previous state that would, that would cover them here in Virginia, that does give them a special enrollment period. And then there are other types of qualifying life events like cancellation of the hardship exemption, changes in income, children who age off their parents' coverage. So at age 26, parents can no longer provide coverage. So the children would get a qualifying life event. Changes in American Indian, Native American status, gaining American Indian or Alaska Native status, changes in incarceration status, or citizenship or legal status. Those all can result in a special enrollment period. So how can consumers apply? They can come to our marketplace, which is marketplace.virginia.gov. Our website is translated into Spanish also. And if they're comfortable enrolling on their own, they can do the whole process on their own. If they need a little bit of assistance, they can reach out to our Consumer Assistance Center. And we do have people there who can answer some questions and help them navigate the platform. We do also have language assistance available through interpreters at our Consumer Assistance Center. But our Consumer Assistance Center, our customer service reps there are not able to help an employee or help a consumer pick a plan, but they can help navigate the platform. We also have assisters and navigators. We have 3 programs: Enroll Virginia, Boat People SOS, and Health Benefit Initiative, that all have navigators that can help consumers navigate the platform, understand what their options are, understand the affordability standard that we talked about. And they can also get assistance through marketplace registered agents. So that's another very good option for them. All of these services are free to the consumers and to you all as small businesses. So people should utilize whatever assistance they feel the most comfortable with. And then I'm not going to play this in this recording. However, you all will be able to play this testimonial. These are just some advertisements that we have put out for people to understand what our options are. And I apologize. It started and I did not intend for it to, but that is the conclusion of our presentation. We encourage you to stay engaged. You can follow us on social media. We do have information available on our website, and you can always reach out to us with questions. You can email us at exchangedivision@scc.virginia.gov. And additionally, we have the sources for information that we gathered from this presentation, and you can find additional information at any of these links. And then we're also providing for you our contact information should you want to reach out to us. Again, you can always reach out to exchangedivision@scc.virginia.gov. That email box is monitored throughout the workday, and that often gets you the quickest response. You can also email me directly at kendra.weindling@scc.virginia.gov. I'm the Stakeholder Engagement Manager, and I will do whatever I can to help you. And you can also contact Brianna Jones at brianna.jones@scc.virginia.gov. And Brianna is our Marketing and Outreach Manager, and she can help you with any additional resources that you might need. Thank you very much for attending, for listening to our presentation today.